Freeman, and I think from Akron Children's Hospital, correct, Stephanie?
I work at Akron Children's Hospital at a PRN basis, and I work full-time at Worcester Community Hospital, and I work with Bobby Beal at Life Ventures for All as a consultant, teaching people how to do venture therapy.
And we will not hold that against you. So for those of you that know that Dr. Beal, that was,
sorry.
That was a comment of affection. So
yeah.
I'm going to mute myself and shut up and turn this over to you, Stephanie.
Oh, okay. Wonderful. So as I was saying, I work at Akron Children's Hospital, but PRN, and I'm working the Psychiatric Intake and Response Center. And so that is looking in the emergency department, and we have youth that come there, and they're here because they have suicidal thoughts or homicidal thoughts, or just kind of struggling. And so I do a lot of suicide assessments, and oftentimes a lot of safety plan and lethal means counseling, because not many meet criteria for acute hospitalization. And as I said, I work at Worcester Community Hospital at a full-time basis. I am the clinical manager of an intensive outpatient program for adults. And so in that program, we also have a high acuity of suicidal thoughts, but again, not meeting criteria for hospitalization. So it's highly important, if they're not hospitalized, for the lethal means counseling. And so today I'm going to be focused on safety planning and lethal means counseling. Oh my goodness. I didn't mean to put that in there. That's actual picture of when I got an email from Bobby, Dr. Beal, asking me to present. Just panic face for a second. But in all seriousness, I might have peppered in a few images throughout this presentation of adorable animals or funny animals. So if you don't like animals, I apologize in advance. But I do think it's important that with such a serious topic that we have to take time for ourselves and just take a brain break. And so I just want to model that we have to remember that in our daily life to take that time, because this can be really, really heavy stuff. Okay, so safety planning. So safety planning is a collaborative approach. We really want to make sure that we're working together with the client to identify those action steps. So if they're not going to be hospitalized, what can they do if they start to have those suicidal thoughts or self-harm thoughts when they're not with somebody? So what are those action steps? We have to remember that safety planning is not a no suicide contract. There's a lot of research that shows that that's an ineffective approach. We need to have more than just I will not kill myself signature. There needs to be, what are they going to do that's going to help them? And when we are completing the safety plan, I'm always kind of watching what are my clients being committing to this plan? Are they being involved? Are they kind of hem-hawing? Because those are signs that if they're not really committed to the plan, and so we might need to seek additional evaluation by either a crisis team, or they might be a candidate for inpatient hospitalization at that point. A safety plan can include a lot of things, but I'm going to go over some of the top things that a lot of safety plans do include. So warning signs. So we're going to be asking our clients, what are those thoughts, feelings, or behaviors that tell them a crisis might be developing? So I put some examples there. So with the kids, it might be more like those anger outbursts, isolating, feeling hopeless, a lot of more negative thoughts about themselves. And so you might have to really work with them to figure out what are those warning signs. I do like safety plans that have check boxes because it gives them a lot of options. So like maybe the clenching the fist or anything like that can be really helpful to formulate that thinking for them. Coping skills. And we're really focused on internal coping skills in this section because we're not always going to have somebody available to reach out to. So what can they do on their own if they're just having some emotions they need to manage or they're noticing some warning signs? So there's a lot of distraction techniques they can use, like drawing, being active, journaling, the breathing techniques. And then a big one I encourage is changing environment. So when I'm working with the teens, I talk to them about if you're in your bedroom by yourself and you're having these tough thoughts, it's probably not going to help you feel any better. And so I encourage them to get around people if that's an option. And then supports. So who can they talk to? Who are those healthy, highly healthy healthy people that they can talk to when they are struggling? And when I'm working with youth, it's imperative to have them identify adult supports. We know that they want to talk to their best friend, and that's what they're going to do. But we know kids telling kids what to do is probably not always going to be the best thing. So making sure they have adults to reach out to is going to be really important. Emergency resources. So including numbers on the safety plan already put there, the National Suicide Hotline, a local crisis number. If they're already established with a mental health professional, you could put the agency number down and what's the nearest emergency room. That if there is a crisis and they can't manage it, this kind of helps the family as well. Where do I go? Because when we're in a crisis, we all know brain is not working as well. So this is why having it written down is so important. And then securing the home. And when you're working with youth, you're going to focus on working with the parents on how to decrease access to lethal means. And I'm going to be focusing a lot of my presentation on that later on. Some tips. So provide copies of the safety plan to both the client and the family. And it's important to remember if it's a 2-home family, to provide a copy for both parents or guardians and the client. This way, if they're at either home, the safety plan's there. Or you can have them take a picture of it, so it's just always accessible. And then there's a lot of safety planning apps out there. I took a look at several of them, and they're pretty good. So if we all know kind of teens, adolescents, or even like young ones now have phones, and so if that will be an easier accessible thing for them, you can look into that. I just wanted to show you a brief example of just what a safety plan looks like. This is one that myself and our team here at Worcester Hospital created for adolescents that come into the ER. And the only thing that's different that it didn't highlight on the previous slide was we added one thing that is most important to me and worth living for is, and so this is just really helping them seek that protective factor or that reason to keep going. And so if you could put that in the plan or even just have them identify that at some point when you're talking about this, can be really helpful. Crisis resources. So you have the suicide prevention hotline that's 24/7 available that they can call. Their Trevor Project, and so this is for LGBTQ youth, so they can reach out either text, chat, or Lifeline, and Trans Lifeline as well. Because we do know in the LGBTQ population, suicide rates are a lot higher. And so it's important that if your client does identify somewhere in the continuum to make sure that they also have that resource. You might be wondering what those weird dinosaur looking things are. I've discovered, shockingly, that you can make any web page into a QR code. So that's cool. So I was like, I'll just pop it on here. So if you don't know what a QR code is, all you have to do is have a smartphone. You just open your camera app up. There's no app required. Just open your camera app. You put the camera phone close to the QR code, and on a little pop-up should pop up on the top of your phone that says the address to this web page. And so you just click it and it'll take you right to the suicide prevention web page, or you could go to the Trevor Project web page or to the Trans Lifeline. So just a little thing if you wanted to take a look at that further. Oh, everybody just take a deep breath, look at that cuteness. All right, lethal means counseling. So this is really important because we're looking at the means reduction component. A lot of suicide prevention is focusing on why people attempt suicide, and we're aiming to reduce suicidal feelings and attempts, which is great, but we really need to focus on how. How do we reduce someone's access to the methods they might use to kill themselves? When working with youth, like I said earlier, we have to work with the family on this because they're the ones that are going to be able to take these things out of the home or secure them in a lockbox or out of the home is preferable for a lot of the things we're going to talk about. I love statistics. I wasn't good in statistics class, but I really do like stats. I think they can help us understand a lot of things. And this was really a fascinating statistic. So this shows that a suicidal crisis can lead to an unplanned or minimally planned attempt. One study asked people seen in the hospital following a suicide attempt when they had first started thinking about making that attempt. As you can see in the chart, 48% said they had first started thinking about it within 10 minutes of attempting. So this shows us that, yes, there are people that do plan these out for days or months, but really it's more quick in the moment, really impulsive. I have this thought and then I do it. And we know with youth that they're even more impulsive than adults. And so it's really, I think this highlights why we need to reduce access to lethal means. Means matters. The lethality of the method used in a suicide attempt is one of the biggest factors determining whether the person lives or dies. We want to make sure we're checking on intent to kill themselves, but we cannot forget about method. If the method is not quickly accessible, we can either delay that attempt, because remember, usually suicide crisis thought is within 10 minutes. So if we can delay that, they can start to think about it a little bit more. It might just prevent them from attempting, or they might substitute that original method for something that's less lethal. And if it's less lethal, it could save their life. So I always kind of use an analogy, at least with my adults, that if I am an alcoholic, I'm probably not going to leave a bottle of liquor in my drawer, because if I'm having a hard time, I might go right to that bottle as a coping skill. But if I have to drive to the store and I have more time to think about that, and I hopefully will stop myself. So same thing with the idea of suicide reduction to access of lethal means is if we can delay that, stop that, give them that minute to think about it, can really help save somebody's life. Here's just a quick graph here of suicide death rates in the US by method. As we can see, the most lethal method is firearms at 51% death rate, following by hanging as second. Considerations for means reduction. So when we're looking at a means of what somebody might use to kill themselves, we're looking at the number of suicide deaths that are caused by a specific method. Lethality, so the proportion of attempts by a given method that end in death. Irreversibility, so the inability to stop or be rescued once a suicide attempt has begun. So if you think about like a firearm, once I pull that trigger, I can't stop myself from pulling that trigger. But if I have medication as my attempt, I can spit those medications out, or we can induce vomiting, stuff like that. But again, so that's what we're looking at. Accessibility, so how immediately available is this method? And then acceptability, culture and or individual tolerance of using a particular method to kill oneself. So this next chart here actually just, again, shows you, so the black means it's high in that area. So number of deaths, lethality, irreversibility, accessibility, and acceptability. The gray, like the darker gray is moderate, and then the light is low. So again, firearms, pretty high across the entire board. And then you have, again, jumping, you really can't take that back once you jump off something. So this is kind of the chart, the criteria they use to show how lethal something is. Long-term survival. A review of 170 studies followed suicide attempters and found that on average, only 4.2% had taken their lives by the end of 10 years. And of that study, about 22% of people who attempted suicide made another non-fatal attempt over a 5-year period. So the reason I want to show this statistic is because if we, again, can reduce those access to lethal means, and if they do attempt with a less lethal method, there's a very low chance that they are going to go on and attempt again, which ends in death. And so again, the more we can reduce access, the better. Now, another highlighting statistic is, although most people who survive an attempt don't eventually kill themselves, approximately 60% in the US of people who die by suicide die on their first attempt. So again, such an important statistic that shows us why we need to focus on reducing access to lethal means. Take a breath. Firearms are used in more suicide deaths in the US than all other methods combined. And as I showed earlier in that chart, it is highly lethal, irreversible, and easily accessible. 1/3 of homes have firearms in their home. Medication overdoses are not as lethal as firearms, but it is the #1 suicide method. So this is the #1 thing people go to, but it is not as lethal. Now, we don't assure that with our clients that this is not as lethal method. That's something that we just want to make sure we know ourselves, that it is the most frequent method of attempt because it is easily accessible everywhere. You can get medications. Over-the-counter medications can be just as dangerous as your prescription meds. So reducing access to firearms, the safest option is to get this firearm out of the home. Storing that firearm away from the home is really going to be important, and I try to encourage that to all the families and adults I work with. How can we get this firearm out of your home? And if they do not want to store it out of their home, which is going to be a common thing that you might hear, then how can we secure this inside the home? So locking that into a safe, and even helping, what would help more is to disassemble that gun, make sure that if they have bullets in the house, it's separate than the gun, and they're all locked away. The more we can put any measure that put time and distance between a suicidal person and a firearm may save their life. For medications, encourage families to safely dispose of all non-used medications. There's a lot of police stations that have medication drop boxes in the lobby that they can just go take the medications and drop it into the box there. It's a safe disposal versus some other ways of just throwing them away is not as safe, or flushing them down the toilet. Medications that are in the home that they have to have, so we want to make sure that we encourage them to lock these up. So secure them, not just put them in a drawer that they don't go into, has to have a lock on it. And for a lot of the families I work with, I encourage them for a less expensive option is to get a toolbox that you can either put your own lock on it or has a lock already on it. That can be a really affordable approach. What about those methods that cannot easily be restricted at home? So sometimes a client's ideation is on suffocation or hanging or other lethal means that are nearly impossible to control access to. So these are the clients who really want to have close supervision from family, friends, or others to ensure they don't attempt suicide, particularly if it's chronic or reoccurring nature. So they have to have close supervision so that we can avoid them attempting those things that are harder to control. So here are some references. I do encourage, if you have time, to look at the Zero Suicide training. It's called CALM. It's called CALM, which is Counseling on Access to Lethal Means. It's a great training. It provides you with a lot of examples, and you have to answer the question. So if you have something that has firearms in the home, what if they give you a hard time, like the parent? Here's some ideas of what you can do. I also provided Caro with a handout that I think she's going to put on the website or email to you all, that has a bunch of resources of different handouts you can actually provide to families that gives them information about what are some locking devices for firearms, or why is it important to not have the firearm in the home. There's also a link that you can click that takes you to like a teen safe proofing checklist. So here are the things that would be important for you to get out of your home or secure in the home. And then that completes my presentation today. And remember, who's awesome? You're awesome.